Nutrition for the elderly. Introduction. Individuals who are above the age of 60 years constitute the elderly. The elderly people can be further classified into different groups. The specific age groups of 65 to 75 years are often referred to as the young old. 75 to 85 years are referred to as the older old, and those who are above the age of 85 are called as the oldest old. Geriatric nutrition. Today, the elderly constitute about 7% of the total population, and the projected figure is more than 10% by 2020. Hence, health and well-being of the elderly is given more importance and has paved way for a specific field of study called as the geriatric nutrition. The field of study pertaining to the elderly is called as geriatrics. The science of study of the elderly is called as geriatrics, and the field of nutrition pertaining to the elderly is called as the geriatric nutrition. Aging. Aging is an irreversible biochemical change that occurs throughout an individual's life cycle, and it continues until death. Genes are the major determinants of the nature of aging. Health and good nutrition may delay the process of aging. Aging varies among individuals depending upon their nutritional status and living environmental conditions. In old age, the nutritional status is determined by the state of nutrition of an individual cell. Conditions like dietary deficiency, improper digestion and absorption of food, insufficient distribution of nutrients to the cells and tissues, accumulation of excess waste products in the body lead to poor nourishment of the cells. With increasing age, cell functioning is slowed down, and the response to hormones and synthesis of enzymes also reduces. These changes are associated with a decrease in the number of the functioning cells. Since the cells are interdependent, if one cell dies, others of the same or different organ lose their ability to function. Say, for example, if one cell in the liver, they lose their functional ability, then the adjacent cells and the other cells in the liver, they start losing their ability to function, resulting in malfunction of the organ. This in turn gradually affects the total body function, leading to death. Changes during aging. Physical changes. Old people develop physical changes due to the process of maturation, like the graying of hair, wrinkling of the skin, decline in the height and a bowed posture. There may be loss of vision, decrease in the sense of hearing. Their physical strength and vigor also reduces. The physiological decline in body functions during aging is not uniform. It varies among different organs. The capacity of the system may not decline, but their ability to respond to a challenge or to maintain the homeostasis is lowered. All the organs, they function normally, but there is no decline in the functionality of the organ, but there is a difference in the capacity of the organ to respond to a challenging situation, and they may not be able to maintain the equilibrium. The physiological changes that occur varies in various systems are as follows. Taste and smell. There is a decrease in the number of taste buds and papillae on the tongue. The number of taste buds in the tongue, it reduces to a great extent. That is why the elderly, they don't relish food like the other individuals. They say that there is no taste in the food. There is no salt, or there is no sugar in the food. The ability to taste salt is very much decreased, whereas that to sugar is less altered. So they are able to taste the sugar as such, like the normal individual, but their ability to taste the salt is less. That is why they complain that the food does not have adequate amount of salt. Besides, there is a reduction in the olfactory sensitivity, that is the sense of smell, which decreases the ability to detect the flavor. So they're not able to smell the food appropriately. And therefore, they say that the food is not palatable, it is not tasty. This decreases the palatability of the food, resulting in the poor intake. Diminished taste and smell decreases the sensory stimulation that may impair metabolic processes. Therefore, they reduce the amount of food intake, which will in turn impair the metabolic processes. Salivary glands, decrease in the salivary secretion or lack of salivation, which is called as xerostomia, causes a feeling of dryness in the mouth. This makes chewing and swallowing the food very difficult. Hence, crunchy, dry, and sticky foods are avoided by the elderly. Teeth. They may lose the teeth or have the ill-fitting dentures, which means when there is teeth in the lower jaw, upper jaw there may be no teeth, and if a teeth is present in the upper jaw, the teeth in the lower jaw may be absent. Therefore, they will not be able to chew the food properly. They may omit fresh vegetables and fruits because they require more chewing. This may lead to vitamin and mineral deficiency also. It also leads to gastrointestinal motility and problems in elimination like constipation. Because they do not consume adequate amount of vegetables and fruits, the fiber intake will be less, and the fiber intake is directly related to the intestinal transit time. When there is less amount of fiber intake, it may lead to problems such as constipation. Gastrointestinal function. The secretion of digestive enzymes and digestive juices decline during the old age. This results in incomplete digestion or food remaining longer in the stomach for digestion. Food is either partially digested or the food remains in the stomach for a long time because the enzymes are insufficient for the digestion of the food. The secretion of hydrochloric acid, intrinsic factor, and pepsin decreases, which affects the absorption of calcium, protein, iron, and vitamin B12. Intrinsic factor is directly related to vitamin B12. Only when intrinsic factor is there, the extrinsic factor, vitamin B12, can be absorbed. And also, since the enzyme such as pepsin is reduced, the protein digestion also is delayed. Above 60 years of age, the rate of emptying of liquids is rapid, which again leads to decreased absorption of nutrients. Gastrointestinal function, the pH of the proximal small bowel increases and there is bacterial overgrowth in the bowel. In the small intestine, there is decreased secretion of enzyme lactase, which can be a risk factor for developing osteoporosis. Since the enzyme lactase is reduced, the milk that contains lactose may not be digested properly, and therefore it may cause problems such as stomachache or indigestion or vomiting, diarrhea in the elderly people. Therefore, the elderly, they stop consuming foods that contain milk and milk products. Milk and also the milk products are avoided. Milk and milk products are rich in protein and calcium. Because of lack of calcium, it can lead to the development of osteoporosis or the thinning of bones. Thinning of gastrointestinal layer decreases gastric motility and prolonged transit through the colon, leading to constipation. Liver and biliary function, there is a decrease in the blood flow to the liver. This may lead to minor structural and biochemical changes. Gallbladder becomes sluggish. That is, the functionality is reduced in releasing the bile, which impairs the fat metabolism. Bile is necessary for fat metabolism and it increases the susceptibility to gallstones. The liver produces the bile and which is stored in the gallbladder, and when the bile is not released appropriately in the presence of fatty food, it can lead to defect in the digestion of the fatty food, and it also increases the susceptibility to gallstones. Gallstones are nothing but the stones that are formed in the gallbladder. The activity of drug metabolizing enzymes decrease, and therefore lower drug doses need to be prescribed during old age. So the liver is responsible for detoxification process. So any chemicals or toxins that enter the body will be detoxified in the liver. Since the function of the liver has been reduced, and also the enzymes that are produced also are reduced in the old age, the drugs that are consumed normally cannot be metabolized because of a reduction in the detoxification phenomenon, and therefore the drug dosage that is required for the elderly is reduced. Metabolic functions, there is a decrease in the metabolic rate and impaired glucose tolerance, which necessitate dietary modification. Impaired glucose tolerance can itself lead to the development of diabetes mellitus in the elderly. The body protein level also reduces. Neurological function, there is a decrease in the neuromuscular coordination. That is the coordination between the nervous system and the muscular system. They may develop a stage of confusion. There is a decrease synthesis of serotonin. Carnitine derived from the amino acid lysine and methionine may be effective in slowing down the mental deterioration. So supplements such as carnitine can be given to the elderly people. Carotenoids play a protective role related to aging and the cognitive function. Cognitive function is how they understand things. Cardiovascular function. Changes in blood vessels such as narrowing of the lumen, that is the dimension of the arteries and the veins, thickening of the arterial walls may take place, and the replacement of the elastic muscle fiber with the non-elastic fibers may occur during old age. This leads to increased rigidity of the vessels, where because the blood vessels should be elastic, now it becomes rigid, which reduces the capacity to carry nutrients to the cells. There is decreased myocardial contractibility and increased peripheral resistance, increasing the prevalence of hypertension. Renal function, there is a decrease in glomerular filtration rate, GFR. It affects the elimination of the waste products and reabsorption of electrolytes. Moreover, the body's ability to regenerate nephrons ceases after 40 years of age. The number of nephrons in the kidney, it reduces after 40 years, and hence there is increased solute load on each nephron, and it may lead to necrosis and kidney damage. Skeletal tissue. Demineralization of bones is more rapid than mineralization, and therefore the elderly people lose their bones, which causes osteoporosis. The bones become fragile. The bones become increasingly vulnerable to fractures and the vertebrae may collapse. This results in decline in height and a stooped or bowed posture. This posture may affect the respiratory function also, because the vital capacity of the lungs will be reduced due to their bowed posture. Pulmonary function. Pulmonary capacity declines by about 40% throughout the life. Among elderly, this may not have an impact on health, but it may impose a restriction on their energetic exercises. Hormonal changes, activity of various glands like the thyroid, adrenal cortex, islets of Langerhans is reduced, resulting in changes in metabolism and the metabolic functions, because metabolism is interrelated with different types of hormones. The hormonal imbalance also affects the calcium metabolism, because the parathormone is the chief hormone which regulates the calcium balance in the body. This may lead to osteoporosis and bone loss. Menopause in women decreases their iron requirements. As a result of menopause, there is no ovulation in the women, and menstruation does not occur after menopause, leading to reduction in iron loss. Psychological change, loneliness. With increasing urbanization and generation gap, nuclear family systems have emerged. The elderly are considered irrelevant and redundant by their own families and are left lonely. Loneliness leads to depression and in turn loss of appetite. They tend to follow irregular meals, leading to malnutrition. Economic aspects. Retirement imposes financial restrictions. Since they retire at this stage, They do not have the income as they had earlier when they were as an adult. The income may have reduced as a means of pension. Many elderly individuals' financial constraints often limit their food intake. Some of them may have very less income, or some of them may not be supported by the pension system, as a result of which they do not have money. And this itself can lead to restriction in their food intake. They may not be able to purchase food, and therefore the food intake may also be reduced. And anxiety. Emotional stress and deprivation leads to alterations in food habits and attitude towards food. In addition, hormonal changes associated with anxiety depress the flow of digestive juices, which may result in impaired digestion and absorption of the nutrients. Loss of self-esteem and independence. With retirement, the elderly may experience a loss of self-esteem or their prestige, which decrease with decreasing physical strength, mobility, and diminishing financial resources. The dependence on others increase. They sometimes feel powerless, leaving the task of decision making to youngsters. This may cause depression and frustration among the elderly. Nutritional needs. Energy. The energy requirement decreases due to decreased physical activity, reduction in lean body mass, and increase in adipose tissue. Decrease in resting metabolic rate by 15 to 20% due to changes in body composition and physical inactivity. Therefore, the amount of energy required also reduces for the elderly. The calorie intake should be adjusted to maintain the body weight of the individual. Energy requirement for the elderly male and female has been suggested based upon the weight of the individual. Protein. The protein requirement does not change during the old age. It is the same as that of the adult requirement, which is 1 gram per kilogram body weight per day. Since the calories are reduced without decrease in protein, the diet should be protein rich when compared to a normal adult diet. The amount of protein in the elderly's diet should be more than that of the adult's protein. Since the calorie requirement is reduced, the carbohydrate content should also be proportionately reduced. Due to impaired glucose tolerance and gastrointestinal disturbances like constipation, the emphasis should be on taking complex carbohydrates such as polysaccharides and fiber. Fat. The fat requirement are also reduced corresponding to the energy requirement. The intake of saturated fat should be less and that of the unsaturated fat more because of the various cardiovascular problems associated with old age. Minerals. Calcium needs increases during old age due to increasing mobilization of calcium from bones and incidence of osteoporosis. During old age, 1000 milligram of calcium is recommended per day because of the following reasons. Limited availability of calcium from foods. The absorptive ability of calcium is naturally declined in the elderly. To compensate age-related bone loss and to improve calcium balance, to prevent fractures and tooth decay because of lack of calcium, and to compensate decreased efficiency in calcium absorption. Aging does not affect iron needs. Hence, iron needs are same as that of the adult's requirement. Mild anemia may affect the health of old people due to inefficient circulation. Therefore, iron intake should be adequate during old age. Vitamins. Vitamin A requirement remain the same, that is 600 microgram of retinol. Inadequate exposure to sunshine may affect vitamin D levels because many of the elderly people restrict themselves to indoors. They reduce their socialization and moving around and traveling, and therefore the vitamin D deficiency may occur in the elderly. In which case supplementation may be required. Vitamin C requirement increases due to stress and medications. Vitamin B6 requirement are also increased due to atrophic gastritis, which interferes with absorption. Liver dysfunction is an additional risk factor for vitamin B6 deficiency. The antioxidant vitamins such as vitamin E, carotenoids, and vitamin C have been identified to promote health for the elderly. Water. Besides these various nutrients, water should be consumed in plenty as such or as fluids like buttermilk, fruit juice if they are not a diabetic, and soups. Intake of sufficient fluids reduces the load on kidneys and relieves from constipation by stimulating peristalsis. Balanced diet chart for the elderly. Cereals 350 for males and 225 for the females. Pulses 50 for males and 40 for the females. Vegetables 200 for males and 150 for the females. Green leafy vegetables 50 for the males and 50 for females. Roots and tubers 100 each for males and females. Fruits 200 grams for the males and females. Milk and milk products 300 each for males and females. Sugar 20 each for males and females. And fats and oils 25 for the males and 20 for the females. In this session, we saw about the process of aging, the various physiological, psychological, and other problems related to aging. We also discussed about the nutritional needs for the elderly. Thank you.